So right off the bat, I need to say this is all theory. It's a guess, educated guess somewhat, but all very much theory. I've been seeing this exercise pop up on the internet, and they're calling it like the stomach vacuum or something, and it's where you breathe out, you breathe out, you breathe out, you breathe out, breathe out, and you kind of suck your stomach in as much as you possibly can. So looking at it from the front, it almost forms like this, cavity. It's something we can all probably do. From the side here, same thing. It goes in and in all the way, much as that's the wrong color. It goes in and in all the way, much as you possibly can. You're trying to get this vacuum effect going on. And I don't necessarily think you should do this. Supposedly, it helps you build a tight waistline. I'm personally of the opinion that we probably don't need that. We're probably better off having a rounded stomach. I think ultimately that's better. But the anterior posterior motion, the in and out motion of these abdominal muscles, one in particular, the transverse abdominis, do serve a function and could be beneficial. So doing this exercise, it's not a recommendation from me, but it does point out something really interesting. So the transverse abdominis is this one that I've highlighted here. It runs transversely, great name, and it attaches into the same kind of shared fascia, this blue area here, same shared fascia as many of the other abdominal muscles. So that's a lateral view, and that's a frontal view that I've just grabbed from our app, Simple Lines Anatomy. And this is what we call a transverse cut. So it's a slice through the abdominal region at about the lumbar vertebrae. And so the green one here, this guy, is a transverse abdominis. And you'll notice, it's not quite drawn in here, but you'll notice it feeds into the same tissues to here. There's a shared abdominal fascia. In the center is the rectus abdominis, for instance. Those usually is the ab muscles. And then we've got the obliques, the external obliques being the dark blue and the purplish color being the internal oblique. And so they're all kind of fused together. Now, the transverse abdominis is the only one that's truly threaded or fibered left to right. So it's doing this kind of a thing. It's doing straight across, whereas the rectus abdominis is more vertical. It's actually, well, let's say it's entirely vertical. And then the obliques are, as the name implies, they go up and down, kind of left to right at the same time. In any case, what's behind it is of real interest, because inside all this is the abdo organs within all this stuff. And it's very much about the way these muscles contract that's interesting. So just to name a few, not that you necessarily need to know these to understand this principle, but there's a liver, give or take right about there. Liver's always got its good friend, the gallbladder. There is, of course, pancreas in and around here. And then we've got a stomach. I don't know why these are colored at all. None of them look anything like this. There's a stomach that looks something vaguely like that. A spleen, even darker purple. Running out of space here. Running behind that. And then that stomach will extend into usually a very long, hopefully a very long, there we go, duodenum, jejunum, ileum, all that stuff. That's not even close. Let me try that again. There we go, something like that. There we go. Small intestine, and that small intestine eventually becomes a large intestine, which that's your most distal portion. That's going to finish the whole thing off. Then we're at rectum. We're at the exit point of all this stuff. So understand, all of these organs are behind the abdominal muscles. So just to draw them in one more time, there's your rectus abdominis. There's your transverse abdominis, like that. And then your obliques go this way and this way. Of course, it would be a lot more fuller than I've drawn them here. But that's basically how it works. And what's interesting about this is that because of the fact that they're in front of them, and because of the fact that there's a whole lumbar spine behind them, just to clear it up, if this is the side view, all those abdominal organs would be located within this space, a little bit bigger. And they're contained in a sac called the peritoneum. Not super important that you know that. But understand that they really can't go backwards because they're running into the spine at that point. So they have a tendency to want to go forwards and down. They also can't really go too far down because there's pelvic organs in the way. We wouldn't want to crush those. That would be actually a pretty bad idea. So as those ab muscles contract, as they go backwards and forward, as they contract, they tend to pull back. They tend to do just this kind of a thing, as shown in that exercise. They tend to go back and in, and they can also, as they relax, go forward and relatively out, and we can develop this stomach here, both of which are fine. They should be able to do both. The muscles are designed to. Now, in particular, the transverse abdominis, again, because it's threaded or fibered from left to right, it has the best ability to go forward and backwards, to create anterior posterior motion because of this threading right here. So it's going to draw it forward and backward best of all. And what's really interesting is, unlike many of the other abdominal organs, it doesn't really seem to have much of a locomotor function. It's not really too involved in motion. The abs are good for flexing forward. They can allow that when we're more horizontally oriented. They also look good. The obliques as well are really good for turning left or right, depending on which way you're going and depending on which orientation the muscle is. But the transverse abdominis doesn't really do any rotation as far as we can tell. It doesn't really do any side bending either. So it probably is for changing or balancing some of the pressure on this digestive system. Now, why that's important alone, that means absolutely nothing. But why that's important is revealed by some of the blood supply, or how the blood to and more so from these organs work. Like anything else, it needs an arterial supply, and that's coming off of the abdominal aorta. This is not to scale, but bear with me. There'll be a bunch of blood supplies into the organs. They each have their own supplies. It's not really too important that you know that. But once it gets there, that blood has to then come out. It picks up a lot of nutrients. And then we've got abdominal venous blood, organ blood, that has to get back to the main circulation. Ultimately, it needs to go back to the heart. So it wants to end up back in the heart. It has to get to the vena cava. This is the inferior vena cava here. What's interesting about this system is it takes one specific route. I've drawn that completely wrong. Hold on. Bear with me. There we go. Okay. So it has to take one pretty specific route. So the thing they all do, again, this is not to scale or not accurate, but they all go through the liver. They all have to get into the liver. Even the gallbladder, even though it's attached to the liver, the pancreas. I'm drawing the small intestine here, but assume there's a large intestine. They have to go through one system, the portal system. From the portal system, they then can go back into this IVC to get back to the heart. Get back to the heart, back to the main circulation. What's neat, and why this is all so interesting, is that this portal system is valveless. It's what we call a valveless system. There are other ones in the body around the spine. Hypothalamus pituitary is a valveless system. And what this means is, because we don't have valves, there's no back check mechanism. Normally what would happen is when blood's going through the venous system, so blood will push up, and if there's any back pressure, say that it's coming in reverse for mechanical pressure or otherwise, or just the internal blood pressure, what will happen is it will push those valves shut. They'll slam shut and they'll close off, so you won't get any backflow. That's really important because we want to keep the direction going. We want to keep that blood going back to the heart. When that happens, it's safe, and it's also a lot less likely to form blood clots. But we've got a portal system, a valveless system in here, so it must be dependent on something else to power it through. Those veins have the tiniest bit of muscle, but not nearly enough to fully support itself. So one explanation is often the respiratory diaphragm, and this is absolutely true. We've got our respiratory diaphragm right about here. That's our main breathing muscle, and that goes up and down to pressurize the visceral system and to help that blood get back. So if we put pressure on this system, and we've got a relatively negative pressure over here, it's going to go in the right direction. And that's one angle. Certainly that's valid, the respiratory diaphragm. We basically know this. But the transverse abdominis, the ab muscles as a whole, but the transverse abdominis take care of the anterior posterior pressure. So they can kind of push inward, as it's been shown. So just going back to this model, they are able to do the inward pressure. It's getting a little messy now, but hey, hopefully this makes sense. There you go. It's able to do the inward pressure, which generates upward pressure, provided everything's oriented in the right way. Remember, the heart's going to be a relative negative pressure. It's going to have space for that venous blood to flow into, as long as it's supplying it to the rest of the body. So maybe, and again, I can never recommend doing any particular exercises. Always check in with someone, a profession or a person who knows a lot more than you, physical therapist, medical doctor, if it's the right thing to do for you. But maybe doing an exercise like this could be beneficial for different reasons other than just a trim waistline.